Santosh sir, are you able to hear me?
Yes, yes, I can hear you.
Okay, thank you so much, sir. Now, I would like to proceed forward. Good morning to everyone. Warm welcome to all in today's session. I hope last two session was very informative. Now, we would move. Are you able to hear me? Like to proceed forward. Good morning to everyone. Warm welcome to all in today's session. I hope last two session was very informative. Now, एक minute. Sir, are you hear me?
Yes, I think there was some echo problem while
Sir,
streaming
wait
on
a
YouTube,
minute.
right?
Wait a minute, sir.
Hello, am I audible? Can you hear me? Okay, yeah, good. So whilst this connecting this Zoom to YouTube, there was some pause of almost 10, 30 seconds. That's why there was echo problem, right? So, good morning, everyone. So, we'll start with the today's session. So, if I'm not wrong, everyone is audible to me. You can hear my voice, right? So, uh, uh, thank you, particularly GSMCOP College of Pharmacy, for providing an opportunity delivering this session on future startups in particular healthcare sector particularly. So I'm working as associate professor Department of Pharmaceutics at Ashpuram College of Pharmacy, Trikwada, Kolhapur. I done my masters in the Mumbai, that is previously called UBC Mumbai, and after that I went for an just wait. Hello, am I too fast or yeah? Is it okay? Hello. Okay, yeah. Thanks. Sure. So basically, I work for almost companies like an Agenda Pharmaceuticals. Then there are so many industrial consultations, almost an 15 industries. I work for them as a consultation, particularly. And last year, I joined this in college, Ashokara Mani College of Pharmacy, after a 8 year stint in industry, particularly. So I'm a pass out of Solapur University, College of Pharmacy, Pandharpur, B Farm. So I was qualified these examinations like GPAT, GATE, and all the stuff particularly. So this is the short. Basically, I'm a consultant, particularly in formulation science. I work for so many industries to develop the one of the innovative formulations, and I solve the challenges. It might be in formulation, it might be in excipient industry. So we have a various consultation services. I do lot them. There are so many products developed by me. They're currently into market. So almost this is old number. So right now this went to almost 26 right now. So there are four commercial technologies which were developed by me. They're into sent to industry and they are commercially. The industry is producing some of the products by using this technology particularly. Yeah. So I request Power Madam to share my screen. Allow me to share my screen particularly. Yeah, thanks. So it's perfect. So if we can see the last 2.5 months story of this COVID-19, right? So everyone is sitting at home. So we are not doing any extra work, right? Because we are locked down in this pandemic situation, particularly. And why the topic that I've chosen particularly that what we can do in developing some of the newer or solving some of the problems by doing something called as startups particularly. So the motive of this particular today's speech is to share some of the innovative stories that has come up with the from the Indian innovators particularly and what we can do this post pandemic era, right? So with this topic I'll start my presentation. So what do you think that what will the future of this healthcare industry particularly and the particular startups this post COVID pandemic particularly, right? So when majority of us are from pharmaceutical background particularly, right? So this post COVID, why I'm saying post COVID, the future. So if you see the last 7 years particularly, so when Modi government has come into the Sarkar particularly, so this startups particularly they are taking the booms particularly, right? From 2014 particularly, because government has made some of the policies that can help the startups to grow and that can help to generate the employability of our youths particularly. From last 7 years, you are hearing this word like startup, stand up India, digital India, right? Make in India, particularly. These are particularly words, particularly we can hear it. But if we see the last 7 years flow, particularly, so majority of the startups, if you can consider, they are into the e-commerce particularly. So you have heard of the Paytm, right? You have heard the Razor Pay, correct? Then phone pay, right? Then there are some of the startups who can connect you the customers to that we call as e-commerce platforms particularly. So biggest names that will be Indian startup, the Flipkart, then the world's biggest platform, that is Amazon, right? There is a failed version, we call it as, why we call failed version, because Snapdeal, it has good, it has a good scope to grow into the market, but due to the, some of the poor management, they failed in their market. So these are the, from last 7 years we have heard of this particularly various e-commerce companies, right? Then there are some of the companies called as fintech company, financial, which can combine the some of the technology based companies, right? Then there are some of the startups who are into the transportations particularly, right? And on the last 3 years, we can hearing the some of the good companies called as we have the Pharmacy, then we have the 1mg.com, right? Then there Netmates particularly, who are basically an online pharmacies particularly, but online pharmacies. So these are the some of the startups who has grown in numerous times particularly, and they got a good business in last 7 years particularly. But this single virus, this coronavirus, has changed the scenario drastically. So we are locked down at our home. We can't order the foods from Zomato and Swiggy and all this stuff, right? And we can't also order some of the stuff from the Amazon because Amazon is closed. And since the other startups like the transport, they are in the transportation and they are moving goods particularly. Since there is restrictions on the movements of the people and the vehicles, so next 2 years, the startups, they have a very good, they have very bad conditions to them particularly. So people are sitting at home, but they are looking out the particularly their health particularly. Majority of them, you're taking the some of the good medicines to improve your immunity, right? So you can't go to doctors. Also, the same condition with the doctors. They don't want to see you doctors, the patients, right? There is a fear. So if somebody got the fever and the runny nose or some cough, so there are chances that you might be infected with COVID, right? So this particularly post-pandemic era that can give you some of the good opportunities, because all the next 2 years there will be a very good scope for startups particularly. There will be a very good scope. That's why I've chosen the particular topic. So if you see the sector of Indian healthcare sector, which is almost 6% of our GDP contribution, right? But if you can see the India's disease burden, we count almost 21% of the world's disease burden particularly. And if you can see some of the doctor to patient ratio, we have 1:1700 particularly. And when you go to hospitals, outside the particular bills and all the stuff, we can spend almost 62% out of the expenditure, right? So these are the some of the challenges which are facing with the particular patients and the common man particularly. So if you can see the total estimated market, it is almost 280 US billion dollars that is estimated this year particularly. So there's a big opportunity for healthcare and health tech companies and startups particularly. And India is one of the fastest growing startup base worldwide. And out of the total startups in India, there's healthcare companies that can count around 6 to 8% particularly in this particular domains. So India is looking at an unified approach for long-term solutions that can help optimizing the disease care to preventive and promotive care as well as patient-centered. Just consider 3 years back, you need to pay almost 250 to 300 rupees for 1 GB data, right? But when the Geo came into market, the data-driven technologies, because the data is the next fuel into the economy, particularly 5 GB per data per. So most of the companies, they are developing solutions, softwares, and apps that can be run on with this data-driven technologies. And government is also pushing some of the campaigns to promote the startups and ecosystems, particularly. So from last 7 years, we are hearing about the startup Indias, right? For the SC, ST, and women entrepreneurships, government is pushing up the stand up India, particularly. And with this technology, government is pushing up this campaign like digital technology. Whatever the sources available that can be pushed up by use of the digital technologies. If we can see the whole structure of these healthcare ecosystems, right? We are interlinked and we are connected with each other, right? So we have hospitals, right? Then we are connected with the medical device industry. Then we took some of the clinical trials for development of new drugs, particularly, and the pharmaceutical industries, right? Then this telemedicine, particularly, and online consultation with doctors, particularly, correct? Then we have a medical tourism. Then the health insurance companies, and all these seven subparts that can be doing some of the startups to promote the healthcare ecosystems, particularly. And there are many young startups who are establishing their credentials through innovative approach and agility, particularly. If you see these particular broad categories of startups, they're working into healthcare sectors. So these are some of the broad categories where some of the startups who are taking the particular new innovative products and services, right? Some startups who are connecting the outlocated patients to doctors who are sitting in the cities, particularly. Some startups who are into an preventive healthcare, particularly. Some they're into specifically into analytics. So whatever the data you can get it from the digital platform, that has to be analyzed, particularly with the help of artificial. It might be an artificial intelligence or just an other platforms, right? Some there are startups who are particularly in pathology. Some they're into an emergency services. Some there is into a disruptive medicine solution. Why I'm saying disruptive? There are innovative. It might be an APIs, it might be an formulation solutions, it might be an services, but they are very new to market, particularly, right? Some of startups who are, can be providing solutions to distributions, particularly, right? So majority of the, if you can say pharma hubs, there are some of the companies who are manufacturing hub, we can say in the Bandi, particularly, right? So there are some of the medical equipment companies who are into Chennai, particularly, and whatever the corporate offices of the majority of these companies were into Mumbai, particularly. So we have an 137 crore people was into India, and there are so many hospitals and pharmacy chains. So how efficiently we can deliver our products to the healthcare systems, particularly. Then we have to get these medicines at an affordable price, particularly. So government that is pushing the Jan Aushadhi, right? And there are some of the private companies who are selling up and giving the affordable medicines, specifically like there are some of medicines who are required for the old age patients. It might be your cardiac medicines, it might be your diabetes medicines, right? And from the last 4 years, we are into the online purchase of medicines, particularly. So if we'll see one or two examples of this particularly broad categories. So we know all these Practo, Librate, 1mg, Eco Health, particularly, correct? So these particularly startups, they are just on an online platforms and web-based or an app-based, particularly startups, particularly. So these startups, what are they doing? So there's a need, right? The patients who are sitting at the remote locations of the rural areas, right? And whenever they require an support from doctors or consultation from doctors, particularly. So they are started with this particular linking the doctors who are sitting at hospitals at the cities to the rural patients. So basically, they are connecting the patients to doctors. And this post-COVID era, right? In last 2.5 months, you have seen that hospitals, the clinics, they are not getting the patients. Why? We are into fear, particularly because this COVID. patients are afraid to go to clinics and the doctors are afraid to see the patients, right? So who is having the fever, cough, and the cold, they are just sending the patients to the government hospitals, right? They don't want to take a risk particularly. But there are so many other conditions where we require consultations, right? If you see the companies in just last 2.5 months, their business has grown an enormous time. There was a data that this companies has got an 70% rise in telemedicine. That is what we call as digital consultations particularly. So this is the snapshot. I got it from the Mint. It's a 3 days back article. I got from Mint particularly. If you see, these are some of the startups particularly called as CureFit, then Practo, MedLife, and PharmEasy. So in just this post-COVID era, they got a good support and good number of business from the telemedicine particular, and particularly delivering of the medicines by putting orders on an online platform particular. So one of the most successful startup in Indian healthcare industry, that is the CureFit, which was almost $750 million particular. So this was founded in 2016. So this particularly CureFit, they're also facing issue because this particular startup was focusing on the fitness of the people. But since fitness, all the patients were locked down at home, we don't go to the gyms, we don't go for the exercise. So they have moved from just fitness to the telemedicine particular, since they got a good response from all over the doctors. So almost whatever the doctors available in India, almost right now in this particular article, if you can see, 70% of doctors are now enrolling to this online telemedicine consultations particular. So there was a good story of this Practo. This was founded in 2008, which was basically help to consumers to locate doctors and healthcare information. So this Practo, which was founded in the Narayana Rudhyalaya Hospital in Bangalore, in 1995, they were so the motive was to get support to the various doctors, particularly, and this particularly activity has started, and it was done on the only mobile phone or an telephone, particularly. Whenever you require support from doctor, you have to call to the number provided, right? The patient gets the consultations, particularly. He has to brief up the disease condition. So doctor will just listening the particular condition. He just provide you an diagnosis or just providing some of the medicines. But at that age in 1995, 1996, we don't have the good connectivity of the data, that the internet. So most of the people, they are getting the good consultations, but the other end, the doctors, they are not getting the money, that is the their fees on the right time. So whatever the patient that has to get the consultation, he has to pay the checks or demand transfer particularly. So it will take time, so almost 10, 15 to 1 month to get the consultation fees. So he started for almost 4 years, but he has to close down this activity. So with his 5 years experience, he has collected some of his friends and started the company called as Pract, right? In 2008, where we have the enormous growth in the digital platform particularly, correct? So in preventive healthcare particularly, so there is a particularly, which is the company in Bangalore-based company, which is particularly in detecting the breast cancer, particularly by using artificial intelligence, right? So there is a technology that developed by this company, which is a software-based app, correct? So this particular app, which can when you put up on your mobile phone, this can help to get to the uh, preventive signs particularly. It can alarm you, this particular software and app particularly. And just 2 days back, this company called as Go QI particularly, this is a Bangalore-based company. There is a particularly this device that can be put it on your hands. So this device can help to monitor the body temperature particularly. So whenever you go into the particularly outside, if you are infected with the particular coronavirus, so this body temperature can be monitored, and that can give you an alarm, right? So there are other two technologies which was developed by indigenous, right? We have this some of the glucometers currently by developed by Roche and Pfizer. So this is the indigenous preventive healthcare in India. in the detection of the biosense, which was developed by smart Bluetooth enabled glucometer for tracking the blood glucose level. So this unit just costing on 1500 rupees. So this was made by one of the company. Then there is another called as Illumina 360 particularly. So this particularly software which can measure the temperature, since the cancer cells, the area when they grow, they have the higher temperature particularly. So this particular increase in temperature that can be detected by using the infrared camera. So this is Cura Alumina company that developed the particular product called as Illumina 360. So which is a safe and early detection of breast cancer where you don't get any pain, radiation, and no touch. So it's an invasive technology. So this is from the also from Bangalore, and they got the support from the Bayrak particular. And analytics like, so this dozy, which is also supported by Bayrak particularly. So this particularly app which can monitor person's heart, respiration, sleep cycles, and stress level during their sleep, which is having almost to 98.4% accurate compared to medical grade sensors. So this brings the medical grade care to the comfort to your home particularly. So this is costing around an 1100 rupees device, contactless health monitor particularly. So which is also supported by Bayrak. So this in startup, which is Live Health. This is from one of the Thane uh, person. So this start Live Health, which is an app based. Whenever you require any doing some of the tests, like it might be your blood test, it might be your urine test, and all others medical reports. So this particularly app is will keep all your medical records in one place. Like we have Facebook, we have a LinkedIn, right? So we have our profile. So this particularly app which can help to keep the data of last 10 years, right? So whenever we do some of the hemoglobin, simple hemoglobin test, right? So we got some 12 point of hemoglobin, right? We just discard it after 6 months. So this app, it digitalized the reports and it will keep to your profile. So this helps to maintain the clinical data particularly. And this was a simple concept by developed by one of the person in Thane particularly. And they got good funding support from various uh, doctors particularly. And one of the booming startup in last 2 years, that is Docplexus. So basically those in the marketing and medical representative, they know it's very difficult to get the appointments of the super specialist doctors or those who run the MD or MS. They are very quite busy, and whenever they get the time, it is just an 1 minute or just 30 seconds we have to get time to elaborate our products, right? So there was the challenge particularly. So this company is connecting the doctors and the pharmaceutical companies to provide the, some of the bridging the gaps between the doctors and pharmaceutical companies. Suppose whenever a company describes the new products or develop the new products, it is very uh, uh, cumbersome to give you the inputs on the particular products particularly, and to know this doctors what are the medical clinical data, what are the formulation aspects of the new products. So this company connects the pharma companies and doctors uh, to share the pharmaceutical or and clinical data with these two aids particularly. So this in pathology, if you can see, this is a product called as OncoDiscover, which is a liquid biopsy technology. So this was developed by one of my senior who is currently working at Pune. Uh, his name is Dr. Jain Khandare sir. He is working at MIT College, Pune particularly. So basically, he's a background of pharma and polymer science from NCL Pune, and then he went to US particularly. So he has a good background of polymer science and pharmaceuticals particularly. So this particularly startup, which is detecting the detection and inhibition of circulating tumor cells in the peripheral bloods, which is called as the OncoDiscover liquid biopsy technology. So this platform technology is consists of the OncoView liquid biopsy kit, which is patented biofunctionalized magnetopolymeric antibody system. So he has developed some of the magnetic polymeric uh, material which can detect the particularly cancer cells particularly. So in NCL Center Pune, in Venture Center Pune, so he has started his activity, and he got the support from the SEDESCO for the test license and the finally the manufacturing license. So this particular kit that can cost around 1,500 rupees. So this will detect the early stage of cancers particularly. And the similar product which is in available in US that costs around 5 lakh rupees per kit. So by using the knowledge that is available with the pharma and polymer science, uh, our senior has developed this particular product particularly. I think who's doing this? I don't know. Just wait. I clear out this. Yeah, and this is the another particular product called as AccuKind Mobile Lab. It's just a single suitcase where we have all the testing facility. So this can easily work for temperature range from 2 to 50 centigrade. And almost 36 tests can be performed in a mobile lab, which includes sugar profile, hematology, kidney function test, liver function test, lipid profile, electrolytes. So this particularly kit that can be handed over to a particular person who can go to the rural areas and he can do some of the tests. Then there is a one good startup, which is a global startup. I call it as urgency particularly. So this, whenever you got an any heart attack or other this particularly conditions, so there are some early signs and symptoms. So this startup who's developed an app where this app has been installed into your mobile, so it can monitor your health of your heart particularly, and this can be give some of the features. So whenever you have any, so whenever you get particularly any symptoms of any heart attack and all this stuff, it can directly give you the alarms, and it can connect the nearest available the physician. So you can directly approach to the hospital. So it can be reduce the particular time. And these two disruptive solutions, that is the disruptive medicine solutions, where I was directly involved for development of the particular products. So this is the company in Bangalore, which is called as Bonayu. So you might heard of the strepsils, right? Sorry. Listerine, mouth dissolving films particularly. So this company called by hot extrusion particularly. So whatever the oral dissolving films, presently they are manufactured by solvent evaporation technology. So we and other some of the nutraceuticals that can be their power strips, which gives them power office goers and students particularly. So the laboratory. So when I was developed to, I was involved commercially successful into market. They are available regularly. And this was the algal RDHA particularly. You might heard this DHA and EPA particularly. So presently they are available from the fish sources. So whenever you got the product from fish sources, the biggest problem is the fishy smell particularly. So you, if you could put just small drop of fish oil, cod liver oil, in, for the next 2 days, you got the smell inside your particular room. So this particularly problem has having issue for the use of this particular fish oil and all this stuff. So this company has developed some of the DH and EPA from the algal sources particularly. So there's a one company in Mumbai called as a Dalta company, correct? So this company has synthesized resources. So our job is to microencapsulate this particular by using spray drying. So we have given this particular product to this Dalta company, and there's another product in the we call as silver clean, correct? So this silver clean, which is alcohol-free lock bottle, which is ideal for clinics, hospitals. So this particularly disinfectant product, which consists of the silver ions. So this silver ions, they are developed by and patented nano AG clean technology. So this product is into a commercial stage. So they want and support for the and also this some of this clearance from Sedascope for the commercial launching. But it is one of the good product from the NCL Pune. So in distribution channels, so in pharmaceuticals, who's doing this? I'm getting annoyed. Please don't do this. So this particularly in distribution channels, there is a particular one, only one startup called as Medica Bazaar, which helps to procure the various medicines, hospital supplies. It might be your gloves to and high-end machinery like CT scan. So all these distributions, you can just put the orders like and we have as we put in on Amazon or Flipkart. So this can be help out to source the various accessories and consumables required for hospitals. So this is one of the only startup in the distribution channels. And just and 1 month back, you have heard this. You, I think you have read this news that correct. Ratan Tata has invested in one of the startup from an Thane based particularly. So here is Mr. Arjun Deshpande. Is particularly he's running his company called Generik Aadhar, which was founded in. So this particularly person has manufacturing some of the cardiac and diabetic medicines from the Badil location, and they are selling into an almost an 30 to 40% cheaper rate to the retailers, particularly. So Ratan Tata has taken a minority stake. It's not a 50%; it's a minority stake in this company because he know the pain of the old age patients, particularly why they are feeling the issues. Hello, yeah, can you hear my voice clearly? Hello, hello, yeah, Anushka. Yes, okay, yeah, thanks. So this particularly startup. So you can also do some of the startups in the providing some of the generic medicines to the patients who are into an old age particularly. So we know there are so many companies who can selling the medicines online, particularly NetMeds. It might be 1mg, it might be Healthcart, or it might be MedLab particularly. So from last 4 years, they are doing good business, particularly in India. And there is a one I want to mention this particular product. So this Plexi OH, which is the next generation bone emulation technology, correct? So this particularly company called as Orthohill Private Limited, which is the this product is Orthohill, which is the first of kind, easy to fix variable orthopedic cast that has the rigidity to hold the fractured part while ensuring proper skin ventilation. Right? Presently, there is only when correct to hold the particularly hand to get healed particularly. So after wearing a quick light treatment, which completes the curing process and making the FlexiOH cast rigid particularly. And this FlexiOH can later removed without use of other the external cast cutter or spreader particularly. So this is intended for non-displaced, minimizing displays, buccal fracture of distal radius fracture, carpal bone fracture other than scalpel. So this cost around the 5,000 rupees for short term cost and 26,000 rupees for the splints for the forearm. So this is the one of the good product that was developed by company OrthoHill. So we have just got the idea what are the particularly domains where all the healthcare companies or healthcare startups they are working on, correct? So as a science background and a pharmacy background, we know what is meant by startups particularly. So basically solving an particular and a problem by scientific innovatively. But there's a big difference between an invention and an innovation, right? So what is creativity? We all know creativity is the act of turning the new and imaginative ideas into a reality. An invention and creation of a new idea or concept particular. And an innovation and turning a new concept into a commercial success or widespread use. If we can see the some of the new drug discovery process, right? Identifying some of the particular enzymes or receptors, correct? So that might be an invention, discovery of the particular receptors, right? And an innovation and particularly development of particularly new synthetic molecules or APIs that can act on particular receptor that can uh, help out the treat the particular disease condition. And an innovation, particularly development of product to into a commercial market. So a stage from getting the creativity, what kinds of the receptor that can be available for targeting, to synthesizing particular the API, and finally developing the finished product and launching to market. So all this journey with their scientific background we called as that startups particular. And why these startups are exist? Because there's a latent need and there are gaps in the particular technologies and no one fulfilling this need particularly. That's why we see lots of problems in our societies, right? So that's why few young scientists or young entrepreneurs, they are coming ahead and developing the particular products to give the particular solutions, right? Or the someone who is fulfilling the need is insufficient, right? So earlier days there were, if you can see, last 20 years, there were some TV channels who can provide you particular the uh, shopping items, but there was some of the issue with the deliveries and payments and all the stuff. That's why the Amazon come into market and they have fulfilled the various challenges particularly. So there is a demand, we need to do some of the innovation and finally supply to market. So this chain, when we fulfill, we got the good support for this startup particular. And how to come up with the startup idea, particularly for an entrepreneurs? What do we wish to solve the particular problem? Correct. So we have to ask yourself, what are the ideas? Correct. We have to find out what's the missing in daily life, particularly. Stand outside yourself to notice, correct, and focus on the idea part that can be proven good for your startups, right? And what we have to do, we have to found something valuable product to giving to particular market, and be sure to make the flexible for the other peoples. And don't forget to discourage when solutions is dismissed as toy and first planes. And finally the probably the solution, and you have to work hard to take it forward for the commercial launching particularly. So when you see the startup ecosystems, so there are so many factors available, right? So we have big companies, we have universities, we have funding organizations, we have service providers, we have research organizations, and finally support systems. So you get ideas, you develop inventions, do research, and then it has to convert into a startup. The startups that may be various stages. Then from the startup, we will enter into the entrepreneurship journey. Correct. We have to find out some of the team members. We have to find out some of the investors, mentors to guide us. We need some advisors for the commercial launching and other entrepreneur peoples and people from other organization to make the successful startup. And in India, see some of the government benefits are also available when you register particular your firm as a startup. So basically, what are the benefits we get? It we basically get compliance regime based on self certification. Like the older concept, you put up the factory, you require the license from the development corporation for putting up the plant, right? You require the NOC from pollution department. You require an NOC from the local district welfare officers, right? So all this can be cleared out. You require a compliance engine based on self certification. You just put self certifications. So also there is Startup India Hub, which will be a single point of contact for handholding, which can support the various startups. And there is a simplifying startup process. Just go to startupindia.gov.in. You get all this support from the government by just enrolling or registering the particular website. Correct. Then there are some of the benefits when you file the patent or trademarks. Particularly, government is providing various supports for filing the startups, particularly at most a 50% discount and an early processing of the patent, fast track patent applications for startups and examinations and disposal also. And there are also panel of facilitators to provide legal support and assist in filing the patents. You can also get 80% rebate on filing of this patent fees by startups. There are some of the relaxed norms of the public procurement for startups. Like we know there's 20% of the government procurement that has to be made, procured from the MSMEs, right? And out of the 20%, 4% government has mandated that it has been taken from the various startups. But the condition that you require 3 years of market existence, so they require a particular experience, particular. So this clause has been removed for the procurement for various government institutes. And in case you failed, particularly, because sometimes we don't know whether it is an feasible or not feasible. If it's not feasible, we have to resolve the particular startup. So there are very less norms for exit for the startups. For the funding, there are various funds available and corpus of almost 10,000 crore for startups. And government is also giving credit guarantee for when you do something novel work, particularly. Very, very important. That is exemption from the capital gain tax. Suppose you have done a startup, particularly, and you have made the stage to startup and you want to sell it, particularly. So right now the current valuation is like 2 crores of your particular product, and the another company who's interested to take over your particular startup, and he has taken the startup by 10 crore rupees. So from just 2 crores, you got an benefits of almost 8 crores. So that we call as capital gain, particularly. So there is no taxes, particularly for capital gains, particularly. That's why the so they got a good response when they sell this particular startup to Walmart US. And also very, very important, that is tax exemption for startups. It is between 5 years, it's not 3 years. When you're a startup for the next 3 years, you get tax exemption. That is the corporate tax, that is which is almost 25%. And when you do any good startup in biotech, it is almost for 7 years. So you don't have to pay almost an 25% per year, which was the very, very beneficial part. Tax exemption on investments above fair market value, and government is also organizing some of the startup fest. You can also enroll in startup fest, and you can also show to get some of the fundings. And most of the persons, they don't know how to get the certifications, right? Like you know that you have good invention or good product, right? Particularly, and how you get the certifications, particularly. So basically, first you require to be an private limited company or an LLP or partnership firm, correct? The age of your company should not be more than 5 years. If yes, your turnover should be less than 25, should be less than 25 crores. If yes, you are into an innovative product which should be add to value to customers and should be commercial, particular, correct? And if yes, if your age is less than 5 years and your turnover is below 25 years, and you are developing some of the innovative product or services, you need to get the approval from Department of Industrial Promotion and Policy, which is the DSR company. So your company is innovative. You need to prove this, that your company is innovative. How you can prove? There are multiple options. The first options, you need to take a recommendation letter from the incubator or incubator in postgraduate Indian colleges. Like we have incubation center in Pune, that is we called as venture center, correct? There's one incubation center which is coming in ISER Pune. In IIT Bombay, we have SIGN, correct? In Bangalore, we have also IKP. In Belgaum, also we have the incubation center particularly. Or if your institute or college is approved by the innovation cell of the EICT particularly, innovation center particularly. So you can take some of the recommendation letter. Yes, the product or service that is developed by this party is very, very innovative. Or you need to take a recommendation letter by incubator funded by the government of India particularly. The third option, you need to take a recommendation letter by incubator, which was recognized by government of India. The next fourth option is whether you're funded by an incubation fund or angel fund or private equity fund or accelerated or angel network. So this story of this generic Aadhaar company, because Ratan Tata has directly invested some of this private equity, correct? So this document can prove your venture is very, very innovative. That's why you are eligible to get certification by Startup India. Or simply, you need to file a patent, which has to be granted by Indian Patent Office. Or also, along with this patent, whatever the product or service that has to be trademark, right? So this trademark and patent that can prove that your product is very, very innovative, and that's why you are eligible to get the startup certification. If you meet the conditions A, B, C, D, E, and any one of app series, then you are in a startup. This is a simple flow, so you can get idea how we get certification from government for our startups. So, as an academician or a students, how we can intercorrelate to develop some of the particular startups? Simply, we have the laboratories, correct? We have the facilities, we have chemicals, we have the good resources for the journals and good resources for the books. So, whatever the product development or process development, we have the laboratories. So that can be used for lab trials, because since we are working in the colleges, if you can connect with your management or principals, so they can help you out for trying some of the experiments, correct? Simply, if you're doing some of the products, since the large number of students are available, because we are working in the batches, the practical batches, so where you can do some of the trials like sensory trials, correct? And since majority of the faculties are available at the college or institutes or universities, you can approach them to get the support or guidance for development of particular products and particular services particularly. And there are so many internship opportunities in industry. So students get good encouragement from industry if you develop the product at an institute level. So that can be scaled down to an startups. And we know, like we get good support from funding agencies like DST, DBT, Rajiv Gandhi Commission, and big, which is a DBT arm, BIRAC, which is an industrial arm, SCRB, and other trust who can support your idea, particular developing particular product. So now I'll tell you how I work for development of this particular products particularly. So basically, I look out the, I have the eyes on the particular journals, the various companies, and I look out the various opportunities in the market. I go to particularly market. It might be your medical shops. I meet doctors and I meet the various the period to know the what are the demands in the particular market. Correct. So it's very, very important to understand the demand, what the market is required, and what is the requirements. And after I get the idea particularly, so I understand what ingredient has to be added particularly inside the particular formulation or something else. So I'll tell you my story particularly. So we know the value addition of the particular products. So there are so many herbal extracts available to market. We know that we have caffeine, capsaicin, then capsaicin 95%, curcumin 95%, or 50% bioavailable form of curcumin. Correct. So this particular products are just as simply an herbal extracts. So this can be used for development of various products. But if we add some of the value or develop some of the innovative products by advanced formulations, so that can be easily taken up by the industry or selling into the market particularly. So this particular product, vitamin C and ferulic acid, when we combine, we got a good response from the particular market, and this is the one of the innovative product into the market. So this particular product, my previous company has put up this particular product in one of the exhibition in London, and that was when the top 25 innovative products in cosmetic segment in 2018. And then we have another product called minoxidil and capexil particularly. So how I get the ideas particularly. So whenever you get to meet some of the vendors or read some of the journals, so you need to find out what are the innovative products that are currently available in the market particularly. So we require lots of ingredients to put up into the formulation. So we are not putting just simply in the raw herbal extract particularly. So we need to take up this particular encapsulated forms particularly. So encapsulation, which is a capturing active ingredients for tests or most stable form of protective flavor pockets. Correct. So most feasible technology could do an encapsulation, which is spray drying to protect the inherent aromas, nutrients, or other properties of food. This is the curcumin or other herbal extract. We have to just put it inside the encapsulated forms particularly. So when we do some of the background data, we found that there's one company in the US particularly called as Salvona Encapsulation Technologies. So they are developing one product called as Salsphere anti-aging particularly. So this is particularly which is for immediate tightening and firming, perceptible within the few minutes. So basically, whatever the collagen that has loosened this strength, that's why we get the wrinkles particularly. So delivery of collagen boosting peptides for long-lasting reduction of fine lines and wrinkles. So we know there are so many herbal extracts which can be directly acted on the particular skin for the collagen boost. Take an example of vitamin E, vitamin C particularly. They are collagen boosters particularly. But if we see sell into the particularly directly vitamin C and vitamin E, we need to do some of the formulation trials particularly. So what this company is doing, so they are selling and ready to use concentrate form of this particular herbal extracts. So what they are doing, this is particular palmitoyl tripeptide, which is a peptide, lecithin, which is a permission enhancer, this vitamin E, niacin, resveratrol, coca, seed extract, and then candelia wax, then punica granatum extracts, and they are making the formulation which can be directly put up into the base cream. You have to just mix it and sell it into market particularly. So just rather than simply selling the herbal extract or selling the peptide, use to sell to various companies. So this is another product by company called as a Salsphere Natural Anti-Blemish particularly. So we know this licorice root extracts, then oatmeal, which is a moisturizing effect, then salic salba, which is a preservative, then chamomile flower extract, which is also having some of the activity on hyperpigmentation. So just rather than selling these four extracts, so this company has made some of the formulation which can be directly put into the base formulation. Correct. There are other products which are very notable, like we have natural antiseptics, then natural multisal flavor, then fragrance, then retinol, then benzyl peroxide, resveratrol, which is having the BCS class 2 molecule. Correct. So this solubility of this particular resveratrol has been solved by this company and they're selling into the market. So if you see the cost wise, the normal extract that cost you around 200 rupees simply a kg to a 300 rupees kg. But the micro encapsulated form, which costs 25,000 rupees to 50,000 rupees a kg. So you can imagine the value addition that was getting by delivering the product into the micro encapsulated form. So this ferulic acid story. So we know this ferulic acid, which is available from various plants. So this we got it from one of the Japanese source, particularly. We combined with various other synergistic effect. So we need to get a solid concrete base. So we got one paper particularly. So it was in a US paper, US researchers. So they have mentioned if when we combine this ferulic acid along with vitamin C and vitamin E, so it can double the photoprotection of this particular skin. And they have also done some of the clinical studies particularly. So with this and solid concrete base, we have combined this vitamin C along with ferulic acid And this vitamin C, we know this particular vitamin C having issue of water solubility and stability, particularly when the moisture, light, and air and water, when this vitamin C getting come in contact with, it just get discolored particularly. It just lost this activity. So we have developed an anhydrous system particularly, and this technology we call anhydrous innovative excipients into market. So we have developed the product and we have done some of the stability studies up to 20 days. So we can see our product is very, very stable. And this particular product, we have also done an excellent stability for 6 months. So this technology, we have sell it to one of the Bangalore-based company called as BioNova under the trade name Nova White C, which is a triple combination vitamin C, ferulic acid, and vitamin E. And also one of the Mumbai-based company called as Dharma Light, which is the selling into market. And another Bangalore-based company, they're selling under the brand name Uglodum. So there is another particular, we know we are developing two and various nanoparticle liposomes and neosomes, all this stuff. If we can develop some of the good liposomal product, there is a huge scope particularly. Let's take an example of this caffeine. This caffeine is seen as stimulant and having one of the good ingredient. So this lipoid cosmetic company from Germany, they have developed the liposomal caffeine. So if you can see this is certificate of analysis of this particular product. So this is the liposomal caffeine, which is having global charge around 12 nanometer. So based on this particular product, so there are a German product available to market called as Alpacin, which is an caffeine shampoo, correct? And there is also caffeine liquid and a double effect. Basically, caffeine shampoo, anti-dandruff, and anti-hair wash shampoo particularly. So this is the one of the innovative product and which got an worldwide success. So we have developed our product, which is the developed by our company, and basically the ingredients and the concept. So this product we have developed by using these technologies, that is the liposomal caffeine, and we also added some of the agents like chrysanthemum. So this particular product I have given to Oknet Healthcare, which is a Bangalore-based company. So this particular product, you can imagine 60 ml they're selling it to 1200 rupees price. And there's another product was based on same technology called Fulidens. So currently we are working with the problems faced with the varicose veins. So we know all that this normal veins having an issue with the blood flow particularly. So in varicose vein, the blood get downwards due to the against gravity. That's why we get an having a tortuous veins, correct? In India, there is no medical treatment available for varicose vein. Only in laser surgery is available. So I was trying to find out whether any options are available in the other countries. So, and I found that there is a particular product in other countries by Sanofi Aventis. They are into selling the particular product. And I also meet some of the vascular surgeons and found out that this is the product they are selling into market, particularly Indian market, particularly. It's a product you can also see this Varco leg oil, which is the combination of the cod liver oil, aloe vera, and curcumin. So I talked to one of the doctor and he said, I don't have any option because after a surgery, we need to put up the topical product for the patient satisfaction. So this particular product is just a combination of cod liver oil, curcumin, and the particular aloe vera gel. So I was trying to develop the product and I found that some of the ingredients like this is very, very, very active ingredient called as Asculus hippocastanum. The normal extract that is selling into market 600 rupees per kg, and a special extract that is a 3.5 lakh rupees per kg. And there are some of the products available into market, particularly they are selling like a tablet, capsule, and particular gel. So why the difference between the 2600 rupees kg and 3005 rupees kg? So this particularly acid, which is found in the plant in the North Indian various hill stations. So this particular plant is basically contain the acid, which is the active form of the particular plant, which is having three activities: anti-inflammatory, uh, venoprotective, and there's another activity. So this particularly product acin, which is available in two polymeric form, alpha and beta. Alpha form, which is an orally active, beta form, which is a topically active. So whatever the products available to market, they are a mixture of alpha and beta form. Correct. So this beta form, which is we have procured from the one of the Bangalore-based company, and we are formulating a product for the development of management of therapy of the topic of varicose veins, particularly. Correct. So this was our stories. So in the post-corona pandemic, particularly, there are some of the areas you can find out, and there are good opportunities like an innovation and research and developments, particularly. You can develop some of the good products for immunity boosting. Correct. Then one of the biggest thing that is a digital health, because we can't go outside and the patients, they need an support from doctors by an online mode particularly, and also like the online and digital education, which will develop some of the services that can be sold out for development of the digital educations, and also like accessibility to healthcare and medicines. Like it might be a diagnosis, it might be your the consultation to final tech, and how you can connect this organized healthcare sector to generate in your the opportunities. So we know the biggest advantage we are having, that is the mobile data, and everyone has the Android app, Android mobile phone. Correct. So in US, almost 70% of the people have been using the internet to find healthcare information, out of which 40% had effectively diagnosed themselves with the physicians. Correct. So healthcare professionals are progressively using digital channels such as video calls, emails, applications, SMS for interacting with their patients, mobile medical representatives and senior specialists to provide the better solutions and advanced forms of medical services. So there are so many domains like information management systems, like digitalization, integration of patient medical records, cloud-based patient record keeping systems, etc. Healthcare discovery, the drug discovery process to doctors, hospitals, help them to book appointments, expert advice, etc. Pharmaceutical drug delivery systems, we are developing some of the startups which can offer online ordering medicines, healthcare equipments, and also develop some of the challenges to so we can solve the particular problems of the BCS class 2 molecules. Then healthcare services, like startups offering home care services in the form of doctor, nurses, care attendants, home ICU services, home chemotherapy, etc. So basically, we have to empower the various startups. So various stakeholders like private sector hospitals, pharma companies, that diagnostic lab, or we can also connect the high net worth individuals. They can put up some of the monies to grow your startups, and also the corporate firms. So if you can combine the all these five stakeholders, there will be good scope for developing a good startups particularly. But there are also some challenges that has to be taken care. Like we know that we require lots of time to get returns. Also, there is a challenge like finding the right inventors. Also, the challenges like long lead time, which will take because validation and approval from the status quo. It will we need to good innovations to develop. We can see some of the my five. We will get some of the good startups. You need to do good market research and analysis of the market to find out the gap, and also to find out the potential need. We call it as idea generation. If you would develop a good idea generation, then this idea generation has to be developed into a commercial product as service. And for the development of particular product, you need to connect with the right people to building your right team for startup particular. Then you have to decide what you want to develop. It might be a product, it might be service. That has to be chosen based on the available best opportunity. You need to look out the what are the options available in other countries. Correct? What are the best options available? Competitors product. Then we need to get support from the academia, government and industry for financial, intellectual, or developing the particular products particularly. Very, very important. That is scientifically innovative, commercially viable concept is very, very important. If it is product is not viable, it might be technically or commercially, then there is a no use of the particular product. Correct. And lastly, we need to protect the concept by using various intellectual tools. You need to file the patents. You need to file the trademarks. Correct. Then finally, with the help of marketing team, you need to launch the product into market, and you need to wait, and you need some patience to grow to the particular concepts. And last, that is, dedicate 100% to your concept. Success is waiting for you, because it requires it lots of time to grow and accept the particular concept by the market particular. Thank you. Here is my presentation. I hope everyone has got idea what the opportunities waiting for the healthcare sector. And as a pharmacist, we are connect the various dots to develop some of the startups. Yeah, thank you everyone for the listening to our topic. Yeah, if you have any questions, you can ask me.
Now we will take a questions.
Yes,
Sir,
sir.
first question is from Dr. Nilesh Zada. Can we
Yeah,
mix the pudina, gulwel, and haldi to form a drug as an immunity booster?
Pudina. Yes, I'm not getting your question.
Pudina, gulwel, and haldi to mix a drug as an immunity booster.
Pudina, gobar, and haldi, right?
Yes, sir.
Yeah, see, haldi has already proved, and if you can see this, some of the this COVID hospitals, they are just giving the hot water and the haldi doodh particularly. Those don't have any symptoms particularly, because we know haldi is very, very immunity booster particularly, and there are so many products available by using an candies, jellies, and there's one company called as a particularly Bangalore-based company. They are selling an haldi milk, like we have flavored milk. So yes, you can add pudina, which is a mint flavor, and haldi, but I'm very doubtful with the third ingredient, whether the patient can be or the consumer can be accepted. Yeah. Yes. Any questions? I'm very doubtful with the third ingredient, whether the patient can be or the consumer can be accepted.
Hello.
Yes. Sorry, so sorry. It was I heard something. Pudina, gulwel, and haldi. Yeah, as a drug. Yes, yes. It's one of the best combination, Dr. Neelaj Yadav sir, because gulwel, it is very, very immunity boosting ingredients, And if you can combine this pudina, gul, and haldi, which is the one of the best combination, you can sell into market. Yeah.
Hello. Any
Yes.
question from participant? Any question? Hello everyone. Very good afternoon. Myself Saili Budwan, Assistant Professor in Genba Sopandra Mose College of Pharmacy, Wagholi. I am very much glad and thank you, Dr. Santosh Gajge sir, that your address have paved a wonderful knowledge regarding the guidance in healthcare sector. These are the very useful information to us and participant as well as our student, which will be prove a better option to do career as a being a pharmacist. And thank you, sir, for giving us a valuable time in this pandemic situation. Thank you, sir.
Yeah. Thank you so much. Thank you everyone for the listening. And once again, thanks the principal, GS Muje College of Pharmacy. Also thanks Rishma Pawar madam for providing the opportunity for delivering this webinar. Yeah, thank you so much. If you have any queries, I can drop you my mail ID, so you can connect me anytime. I was always there on LinkedIn. Okay, so whenever you require any support, I always there for any formulation or any startup activities. Thank you so much for your patience. Yeah. So this is my mail ID. You can catch me or my mail. So I can always help